I'm Jerry Courtney, president of the Lima Y and co-coach for Activate Allen County. I would like to introduce Robert Baxter, CEO and president of St. Rita's Medical Center, and also a member of the Activate Allen County leadership team, to extend a welcome.
Welcome everybody to this year's Health Summit. Jerry asked me if I would be willing to say a few words of introduction. I asked for how long. He said 4 to 5 minutes ought to be fine. Well, good news. I left my notes at home, so I won't speak for 45 minutes. I will do 4 or 5 minutes instead. But this is really day 2 of a wonderful Health Summit. Day 1, seeing the community meal and the unveiling of the bus that we have behind us today. And something like this really doesn't happen without a lot of folks pulling together. An event like this, it really does take a village. So I'd like to start by acknowledging our event sponsors. And our event sponsors include Chiefs, CDC, the Bob Evans Foundations, Lima Allen County Chamber of Commerce, Lima City Schools, and Allen County Economic Development Authority. And our produce partners are American Beverage Association, Apollo Career Center, CSX Corporation, Husky Energy, Lima Allen County Regional Transit Authority, Lima Family YMCA, Benecote Corporation, Potash, United Way of Greater Lima, U.S. Conference of Mayors, and West Ohio Food Bank. I'd also like to acknowledge the efforts of several groups and individuals, including the Activate Allen County leadership team. I want to welcome on my left and acknowledge Redonda Malone, our program manager from CDC for our Small Communities Transformation Grant, and Chris Burns-DeBasio for chairing the planning committee for the Health Summit. And I'd also like to ask the following people to stand if I could, and this is really the planning committee for today's event. Chris, John Snyder, co-chair OSU Lima, Ann Miles from the Lima School Board, Bambi Markham, West Ohio Food Bank, Chris North, Ohio Northern University, Mary Jo Ferda, OSU Lima, Monica Harnish, Allen County Health Department, Denise Barnes, Activate Allen County, and Sherry Mitchell, Activate Allen County. Please join me in giving a hand to all those organizations and individuals. Thank you. We really are living in a transitional time in healthcare, and you only have to look at the calendar to realize that's so. At a national level, we're only days away from having health insurance exchanges implemented. It's been said before that if the U.S. government was a company and was a LLC instead of a country, that it would be a company that primarily was involved in healthcare and dabbles in national defense and education. At the statewide level, we have an ongoing dialogue regarding Medicaid expansion and what we'll do with that. And certainly as Americans, we don't receive the years of life expectancy for the dollars that we spend that we as Americans ought to expect. But underlying all of this is the choices that we make in the communities that we live in, and a focus on wellness and well communities. As my friend Jerry Courtney has said many times, our health is more an outcome of where we live, how we live, and the choices we make, rather than the healthcare systems that are available to us or some of those more acute parameters. And so I think when you look at today's activities and the focus of both day 1 and day 2, it really underscores how we can create a healthy community. And lest you think this is too big of a task, I'm reminded of the words of Margaret Mead, who said that never doubt that a small group of committed citizens can change the world. Indeed, it is the only thing that ever has. So while this seems like a monumental task, I think it is one for which we are up to the challenge. So I want to close by thanking today's presenters, speakers, organizers, and thank you for your willingness to participate. Have a wonderful day.
Thank you, Bob. I would like to introduce the world's greatest health commissioner, and she's going to introduce our keynote, Kathy Long.
Thank you, Jerry. I'm not sure about world's greatest, but Allen County, definitely. So, But this morning, it's my honor and privilege to introduce Karen Shore. Karen is the Associate Director at the Food Trust, which is based in Philadelphia, Pennsylvania. And the Food Trust is a nonprofit organization whose catchphrase is making healthy food available to all. Karen has 17 years of experience in the intersection between consulting and public health. At the Food Trust, she leads the consulting group helping clients nationwide benefit from the organization's deep knowledge base and successful, innovative programs to expand access to healthy, affordable food for all. Before the Food Trust, Karen worked as a senior program manager on the global health team at Booz Allen Hamilton, helping lead multiple engagements with the Department of Health and Human Services. Karen is a co-founder and co-director of Sunday Suppers and coordinates the efforts of 75 volunteers to cook and deliver healthy, locally sourced, and nutritious meals for elderly residents in need. She's an active member of the board of directors at the Swarthmore Food Cooperative. Karen holds a master's degree in public health from Johns Hopkins, where she was aligned with the school's Center for a Livable Future. And there, Karen studied food and agriculture systems, nutrition, and the epidemiology of obesity and obesity-related chronic diseases. Karen Shore is going to talk to us this morning about healthy food access, barriers, and innovative retail solutions. I invite you to listen for new ideas about food in Allen County and why it matters, not just for health, but for the community as a whole. So please join me in giving Karen a warm Allen County welcome this morning. Karen.
I'm a little nervous. I see a lot of overturned coffee cups. Does everyone have coffee? It's really my pleasure to be here today and to get a chance to speak with you about things that are near and dear to my heart, and I feel have been near and dear to my heart for most of my adult life. I work at the Food Trust in Philadelphia, and we're a nonprofit organization, actually 21 years newly, doing work in healthy food access. And we have 115 staff, and our mission is to make healthy food available and affordable to everyone. And we do that in a number of different ways. We have school programs, some of the most comprehensive school programs that I am personally aware of, where we do work with the food service directors to learn how to prepare and handle and store and make taste delicious, fresh, healthy food from the school gardens, from local farmers, and so on. We do work with menu transformation, so making the menus as healthy as possible. We were one of the first school districts in the country over 10 years ago now. Now this is almost commonplace, but it certainly wasn't then, to eliminate unhealthy vending machines and sugar-sweetened beverages from the school. And we do all of the direct nutrition education programming in the schools. We're also the regional lead coordinator for the National Farm to School Network, and so we oversee the farm to school efforts in 7 states of the Mid-Atlantic region, including West Virginia, Pennsylvania, New Jersey, down to Virginia. And in doing that, we work really closely to figure out how to not just get local food into the schools, because that's really a farm to cafeteria program, but really how to have the kids aware and appreciate where their food comes from, how to integrate the school garden into the cafeteria. No easy task. We run the oldest and largest healthy corner store program in the country. I'll talk to you a little bit more about that in a few minutes, but it's 650 corner stores in Philadelphia that went from being your typical bodega corner store selling cigarettes, and we don't sell liquor in Pennsylvania at anywhere other than a state store, unfortunately, so we don't have a liquor problem that many people do, but we have cigarettes, of course, and nothing but junk food and sugar-sweetened beverages in many of these stores. And we worked really, really hard on the ground with the corner store owners to come up with an economically viable way to sell healthy food to local residents, and I'll talk about that. Supermarket campaigns, we've been doing that around the country, opening up supermarkets, grocery stores in underserved communities. Farmers markets, we run 25 farmers markets, 24 of which are in some of the most underserved areas in the Philadelphia region. We also, you can spend a lot of time talking about healthy food and the ways that you want to eat, and sometimes it feels a little overwhelming. It feels a little, like food is the enemy. And so we actually do a lot with food celebration, trying to get people, it's okay, food's good, it tastes good. And we do night markets, which is a really fun thing where we get 50, 60 food trucks selling. It's not all healthy food, but it is all freshly prepared food from ingredients. So there's no kind of prepared food. There's no additives, preservatives, and things like that. And some of it is quite healthy and locally sourced. Where we close down, city blocks, going in each direction in Philadelphia, and have this kind of wonderful economic stimulation evening of celebrating food. We have bands, we have art, and so on, and bring everything together. And we place them strategically in areas that are kind of up and coming, not, sort of the wealthier areas of town, not the most low-income areas of town, sort of areas that could use a little support, but where people might, sort of have already the businesses and have some of the restaurants where people might need to come back to and want to come back to. And we do technical assistance and consulting work throughout the country, trying to, lift up what we have been doing in Philly and helping other communities and organizations do that work as well. So we do work in 32 states around the country, on-the-ground programming in 32 states. Unfortunately, Alaska and Hawaii are not pictured, and unfortunately, we do not do work in Alaska or Hawaii. That is, I would like that to be a goal. It would be very, very nice to do that. They certainly have food access issues, and that's my next year plan. So today's agenda is, I'm going to be covering a lot, so I'm going to be talking really quickly. It's good I'm from the East Coast. But we're going to talk about what's going on. So what is happening with food insecurity? Why are we here? What are some of the challenges that obesity causes? And we're going to talk about what some of the barriers are to healthy food access and some of the innovative solutions to help address them. Now, at the risk of having Johns Hopkins show up here and take back my public health degree, I'm going to be talking about a lot of things that have nothing to do with health. And we're going to be talking about, economic impacts from a lot of the work that we're doing. We're going to be talking about human rights. We're going to be talking about, well-being, which is different actually than health. We're going to be talking about national security. Stay tuned for that. That's an interesting one. And we're also going to talk about, as I said, that we're not at the mercy of this epidemic, that there are things that we're doing, that you're doing, that are actually working, and that we finally are getting to a point where we have some evidence-based, approaches that seem to be working, where we're not only, kind of at the mercy of this intractable epidemic, but we are actually able to do things to stop it and to even turn it around. And I'm also going to talk to you today about industry. Why they're not evil, far from it, and why we really need to engage them and bring them to the table, not just so that they feel better about being involved, but because we need them there. We need to learn from them, and we need to make sure that any interventions that we suggest having to do with healthy food retail make sense for their business model and allow them to do what they do, what they're intended to do, which is to make money. That's not a bad thing at all. We need them to be profitable in order to bring jobs to our communities, in order to provide a revenue, tax revenue base, and so on. And finally, we'll wrap up. I'm going to be talking quickly today, how it is when you have to cut slides. They're like your children. So I'll be going through slides pretty quickly. And I hope that we have time for a few questions in the end, but I'm not going anywhere when this is over. And I'll put up my email address. I'm really someone who's very open to, continued dialogue. And I'll be here at the conference for most of the rest of the day. So please come up to me and talk to me. Okay. This is a quote from Aristotle, and I thought it would be a good way to start out talking about making the case for healthy food access. So this is a disclaimer. We're going to be talking about food today, and I've given a lot of presentations in my life, but I don't know that I've ever given a presentation where something is more contentious, where people have more opinions about the right thing to do and the wrong thing to do and what not to do than when you talk about food. So particularly how to solve problems related to food, obesity, hunger, food access. Food is connected to family, health, religion, culture. It is how we celebrate. It is how we mourn. It is how we reward ourselves and how we get through hard times. It's how we show love and care and tending for others as well as for ourselves. And as many of us have encountered in our own personal lives as well as professionally, people have a whole lot of opinions about food. So we are, certainly a group of hardworking and dedicated folks, or we wouldn't be here. I also feel like I wouldn't be doing justice to giving a keynote speech if I just told you a whole bunch of really boring things. So I will probably say some things that you disagree with, and I will probably say some things that, challenge to stretch you a little bit, or that maybe you think that there's a different way of doing it. And I'm always interested in hearing what those are. But bear with me, and we'll do this. Okay. Oops. Okay. Missing a slide. Okay, so this is something that you probably have all seen quite a bit of, and this is the rate of obesity in Allen County. Currently, 2 out of 3 Ohioans are overweight or obese, and the problem is that in some areas of the country, that's actually leveling off. The problem is it's not here. It's continuing to rise. And, let's personalize this a little bit. What does this mean? Well, 1 in 3 adults living in Ohio are diagnosed with arthritis. I'm not going to go through every, impact of obesity and diet-related disease, or we could be here all day. But I just want to sort of personalize it a little bit and talk about some of these. So arthritis is painful. It is not fun, and it is not easy to live with pain every single day. I don't know, probably if I asked for a show of hands, how many people in this room have arthritis or know someone, a loved one who is living with arthritis. Most hands, my guess is, would be in the air. And arthritis is, in fact, the most common form of disability in the United States. And if you don't have it yourself, that's really wonderful news. But for the loved ones, I'm sure, of yours who do have it, it's an extraordinarily, painful way to live, and it contributes to, the joblessness as well, because, as I said, it's the leading cause of disability in the U.S. So 85% of high school students and 79% of adults living in Ohio consume fewer than 5 fruits and vegetables a day. So I have children. I have 3 of them, ages 8 to 11. I do not have barriers to food access. I hold a degree in nutrition. I know how to cook. I like to cook. And I can tell you that I have a hard time getting my kids to eat enough vegetables. And that really concerns me because I think more than, one time, many times, too many times, I get to the end of the day and it's dinner time. And I realize that even if it was a day where my kids ate fairly healthy, say they had, I'm just making this up, a whole wheat bagel for breakfast and a yogurt, and for lunch they had a PB&J and an apple and, pretty healthy stuff. We get to dinner and they haven't had vegetables yet. Well, it's a little hard to cram in, the other 4 servings of fruits and vegetables at dinner time. And so I always say, if you get to dinner and that's the first time you're eating vegetables, man, you are already behind, and there's just no way to make that up. But it's really far too easy to do with kids. And so, it's important. Studies show that people who consume fruits and vegetables on a daily basis, and a lot of them, right? We're not talking about like I had my broccoli today. We're talking about 5, 6, 7 servings of fruits and vegetables a day. Have lower rates of every chronic disease, lower rates of obesity, and even in the face of other lifestyle issues like lack of exercise or smoking, they're still better off because of eating the fruits and vegetables. We know it's extremely important. What is this? this probably looks fairly familiar to you. This is a factory that closed down in western Pennsylvania. Workers were laid off, jobs were shipped overseas, and workers and their families, often entire communities, were cast into nothing short of hell almost overnight. What in the world does this have to do with healthy food access? The answer is everything, and I'm going to tell you a little story. A colleague of mine was at dinner with some representatives of a nonprofit organization that recently traveled to China to learn more about what they were doing in food access. And there they met an extremely wealthy businessman, that community's version of Bill Gates, right, who owned many factories there and was extremely wealthy. And the way that he decided to use his millions and millions and millions was to focus on healthy design of his community. He invested millions into sidewalks, new parks, new playgrounds, pedestrian bridges, redesigned crosswalks, bike lanes, healthy streetscapes. And they asked him, no offense, sir, but this isn't the kind of thing that gets your name in headlines. You're not finding a cure for a rare disease, and you're not building a new, medical wing at a amazing research facility. And they said, with so many more high-profile and frankly less sort of fringe things to spend your money on, why did you do this? And here's what he said: I did it so we don't end up like America. I'm going to say that again. He said, I did it so that we don't end up like America, overweight and sick. You spend so much money on caring for your sick and focusing on your sick, all of your energy focused on sick and disease, that you don't put it towards things like innovation and shoring up your own infrastructure. Your bridges are crumbling into the ground, your airports are bogged down, and education of your children. So how much money do we spend each year as a result of obesity and diet-related disease in the U.S.? $147 billion, and by the way, different numbers are bounced around. I took the lowest number I could find per year. What could that money be spent on? In 2008, the CDC said the total cost of obesity and diet-related disease, which was the most conservative number, 147. I've seen that number go as high as 200 billion. So what's wrong? Well, I'm not going to go into a whole lot of detail about this, and I know you're going to be hearing a lot later on about some of the human impacts of obesity and the causes. But there are many causes. This is the Institute of Medicine, the Weight of the Nation, and looked at some of the causes of obesity: lack of physical activity, lack of access to healthy food, overconsumption of unhealthy foods, food marketing of junk food, right? Not a lot of tomato companies marketing on Saturday morning cartoons. Healthy food access, school food problems, big problems. So what are we eating? A whole lot of sugar and a whole lot of refined carbohydrates, things high in saturated fat, fried food, junk food. We know this, right? This isn't really entirely new. I'm going to share with you some different perspectives on the problem, and I'm encouraging, I'm going to just be upfront. The purpose of me sharing these with you is to, this isn't something that people have only been thinking about for the last couple of years. This isn't related to one administration or another. This is something that has really kind of been growing in this country since really the early 80s, when this epidemic really began. This is a quote: regarding the big rise in obesity now that everyone's reading about, particularly obesity in children, it's really important for mothers and fathers to take control of what their children eat. Former First Lady Laura Bush said that. Slowly but surely, we're beginning to turn the tide on childhood obesity in America. Together, we're inspiring leaders from every sector to take ownership of this issue. First Lady Michelle Obama. Here's one that I'd like to take a little time on. Being overweight or obese turns out to be the leading medical reason why applicants fail to qualify for military service. Today, otherwise excellent recruit prospects, some of them with generations of sterling military service in their family histories, are being turned away because they are too overweight. 100 retired military generals from all 4 branches of the armed services issued a report that was delivered to Congress, completely bipartisan. If you've ever known a military general, and I've had the pleasure of knowing a couple, bipartisan might even be pushing it. This is a pretty conservative group of folks. And they issued a report called Too Fat to Fight. It is the leading reason that young men and women are turned away from military service. Bright young men and women, dedicated young men and women who want nothing more than to go and fight and serve their country are turned away at the door because they are so overweight that the Army or the Navy or the Air Force or the Marines can't invest money into helping them trim down. 42% of young adults ages 18 to 24 are either overweight or obese. This equals 11 million young adults that will never have the opportunity to serve our country. To be within the healthy weight range for service, those young people would need to lose 400 million pounds. The Army has numerous regulations on its own called the Army Body Composition Program. I read, and then my eyes started getting bleary, 37 pages of regulations about body composition. I'm going to read just a couple. Soldiers flagged under DA Form 268, et cetera, under the provisions of AR 600, et cetera, suspension of favorable personnel actions for being overweight are reassignable and deployable. On reassignment from one unit to another, the flag and weight control records are transferred to the gaining unit. If satisfactory progress is not made after a period of 6 months in the weight control program, so there's an entire program, if that wasn't clear from what I said earlier, that the whole goal of the program is to get soldiers to lose weight and to keep their weight off. If satisfactory progress is not made after a period of 6 months in the weight control program and no medical reason exists to cause the overweight condition, the unit commander will initiate a mandatory bar to reenlistment. This is a problem that the military is taking extremely seriously. And one final one. Fruits and vegetables are anytime foods. Eat a rainbow of fruits and vegetables every day. That's Elmo. In case you haven't noticed, and if you haven't yet, I encourage you to, the Muppets have been enlisted, to borrow the military term, in this effort. And Elmo is on board. Lily, the food insecure Muppet, is on board. Cookie Monster now sings about eating cookies in moderation. So if you haven't gone to YouTube and Googled some of the Muppet videos, you really should. It's really amazing. And they're actually, trying to use Elmo nationally to, promote consumption of fruits and vegetables. Who or what is impacted? Individuals. That's what we focus on a lot, right? Health, disability, disease, but also well-being, happiness, feeling good about yourself, feeling good about where you live, feeling proud of your community. Enterprise and business, healthy, growing businesses with an active, functioning workforce that is not on disability, that is not sick, that can do the work that they need the workers to do. New jobs, community, these are just some of them, of course. Stronger schools, economic revitalization, public safety. So when you take a store where most of the business that happens in the store is drug related, and most of what's sold in the store is liquor, cigarettes, and so on, and drugs. And you turn it into a store where healthy food is sold, where the messaging in the windows is more about the food that's in the store than about the substances that are pushed in the store or sold in the store. And you create not only a place where people have healthy food access, but you create a place that is safer. You create a block where that is not happening. And you create something that the community is proud of. And you start to create that community anchor that has been lost in so many towns. Making the case for healthy food access. So the Grocery Gap is a report that was issued by PolicyLink and the Food Trust, where back in 2010, we stated all of the research on why healthy food access matters. And we have just worked with PolicyLink to finish the update, 2013 update. I'm sharing with you the sort of preview of that. It's in press. It's not yet been published anywhere. 172 new studies in the last 3 years alone looking at the impact of healthy food access initiatives. And here's a summary of the findings. Accessing healthy food is a challenge for many families, particularly those living in low-income neighborhoods, communities of color, and rural communities. Living closer to healthy food retail is associated with better eating habits, decreased obesity, decreased diet-related diseases. And here's a new one. This wasn't in the last report. Healthy food retail stimulates economic activity. In 2011, grocery sector sales exceeded $540 billion in this country, and more than 2 million Americans were employed on the payroll. 24 new jobs are created for every 10,000 square feet of retail space. So for an average-sized grocery store, that could be 50 to over 120 new jobs. It also keeps the money local. So what is food insecurity? It's household level. It has to do with economic and social conditions. Low-income communities where a substantial percentage of residents have low access to affordable and healthy food retailers. And it can be anywhere. So what does healthy food access look like? First, it's having a place to buy groceries. At a place that you trust, that sells groceries you want. That gets into a whole lot of really important things, like is the food culturally appropriate? Is the food quality food? Or is the produce fresh? Does it have dents in it and bruises? Do the potatoes have eyes? Is it wilted? Is it wrinkled? And often it is, because in low-income communities, grocery stores that are there have a whole other tier of produce that they sell. The same grocery store chain in a low-income community sells completely different food than that same chain sells in a regular income or certainly high-income community. People don't realize that. And then I sort of, I talk to people, and I would bet that no one in this room would feel this way, but I talk to people and they say, well, yeah, but, in a higher income area, they can afford nicer tier of things. It's like a mall, right? You have sort of fancier clothes and better jewelry and so on. And in the lower income mall, you have sort of, off-label things and not quite so fancy. And I'm like, yeah, but we're talking about food. We're talking about apples. So you can't say to me that it's okay that someone in a high-income community gets the shiny, red, plump, juicy apple, and someone in the low-income community gets like the bruised, dented, kind of shrivelly, funky apple. That just, that's a non-starter right there, right? Like there's a really big difference between fancy clothes and food. It means, food access means having the ability to get to the store easily. Transportation, right? And that means having a car, being able to borrow a car, or having the store be located, public transportation routes, close to bus stops and so on, or subway stops. And it also means accommodations for disability. It means knowing what to buy, knowing about nutrition, knowing about food. How do you select good food? I loved walking through the bus because on every single bin it said what to look for, right? How do you know what to buy? What is a fresh which cantaloupe do you buy? Which pepper do you buy? How do you know which food is the freshest food, most quality food that you should buy? It means fair and honest marketing about the food, and that healthy food is the norm. It means being able to pay your bill, right? Having a way to pay the bill. EBT card, debit card, cash. It means knowing what to do with the food once you buy it. How to store it, how to cook it, how to make it taste delicious. I'm going to talk quickly about some of the programs that we do in Philly. So this is a map. This is the city of Philadelphia, and the dots are our interventions, our programs. Schools, supermarkets, farmers markets, corner stores, and rec centers. We did a GIS mapping, of course, in order to determine where to locate these interventions, and located them in the areas with the highest rates of chronic disease, lowest household incomes, highest rates of obesity. Our school programs have been going on for 15, 16 years now, and include healthy vending, healthy concessions, menu transformation, farm to school, school gardens. We do all of the direct programming for nutrition education in the schools. And we have seen in Philadelphia a 50% reduction in the incidence, that's new cases of overweight in Philadelphia school children, and a 5% reduction in the prevalence of obesity. We're one of the cities in the country that has a really strong, comprehensive, multi-layered approach to solving this problem. We're not just doing one thing. And we've sort of built up layers so that the kids go to school and they learn about healthy eating and they eat healthy food when they're in school. And on their way home from school, they pass the bodega and they're able to get a healthy snack there. Or there's a truck across the street that sells healthy snacks. All of the nutrition education lessons are tailored for that individual community so that it's not like this, sort of theoretical, eat more fruits, but it's like, no, eat this, because they sell this in your corner store. Make choices, how the kids can make choices about the foods, sort of using pictures and images, doing tours of their corner stores. So diverse, stakeholder engagement. We, of course, engage policymakers and rec center directors and store owners, large retailers, of course, teachers and school administration. And with a nod to Buffalo Springfield, something's happening here. So we have been seeing finally this turnaround, which is so inspiring. And that's not, we're not the only place that's starting to see that after around a decade or so of really, intensive interventions and a lot of hard work and kind of wondering when you're going to start to see results. And now throughout the country, people who have, organizations, cities that have these kind of multi-layered approaches are starting to actually see not just stopping and a leveling off, but a reversal of trends, which is it's really wonderful to see. Healthy corner stores. Why corner stores? Well, they're there, which is really different than a big grocery store, which isn't there and hasn't been there for 20 years. So it's existing infrastructure. Proximity to underserved residents, it's part of their daily behavior pattern. They are all used to going to the corner store once, twice, 3 times a day. Opportunity for health impact, of course, to expand food access, but it's also an opportunity for economic impact. Our corner store program makes a profit in every store, 650 stores. If it didn't, how on earth would we convince the store owners to implement it? The whole point is not to be subsidizing a healthy, corner store program or a healthy retail. The point is to make it economically viable so that it stays on long after we're gone. So, 95% of our stores are in high priority areas. 36 new healthy products are introduced on average, and that's just at the basic level of stores. We have 3 tiers, and even at our basic level, they're introducing an average of 36 new products. We only ask them to introduce 4 to start the program. Supermarkets, we've done 88 projects, giving 400,000 residents access to healthy food. We've created 5,000 jobs. With the National Fresh Food Financing Initiative was modeled after the work that we did in Pennsylvania. And we use a task force process that's tailored to the individual community and that's trying to get the grocery store. Farmers markets, we run 25 farmers markets, all of them except SNAP, EBT, WIC, and FMMP. Of course, they have, we've had, like trial and error of how best to implement EBT at farmers markets. We've been doing this for a very long time. And now we help do training and technical assistance for others trying to do farmers markets in low-income or rural communities, because if there's a mistake that was made, we made it. Innovative and unique approaches to serving low-income residents. The economic impacts are tremendous. One of our largest markets sells more than $1 million a year in mostly fresh produce. There's some honey and soap and things like that, but it's mostly produce. So I want to talk about some trends and hot topics in healthy food retail. And I want to start by saying that a lot of what we've been talking about, a lot of what we are all doing is new. So there's nothing old news about trying to get kids to eat healthier or trying to do a garden at a school. These are new approaches. So I don't want to, if it's not, and it's also what I'm about to talk about is nowhere close to being a comprehensive list of every new thing happening in food access. So if it's not on the list, it doesn't mean that what we're doing is somehow old. And the way that it's supposed to work, of course, is to consider new ideas, consider new research, build them into our programs. If we're doing the same thing, for 10 years, 20 years, is probably something wrong, because communities change often a lot faster than that. But here's what we don't want to do, right? We don't want to embrace new just for the sake of being new. And a lot of times I have found I myself struggle with this. My team struggles with this, where you read a research article and you're wow, they tried this amazing new intervention and we got to do that, That sounds great. Let's go, try to get a funder who will fund that and we'll try it out, and that sounds amazing. And I love risk-taking and I love innovation and I love doing those things, and I'm probably preaching to the converted on this, but there's only so much money that goes around, and we want to make sure not to be sort of jumping on the newest thing just because it's different than what we're currently doing that may be working really, really well. I want to talk about in-store marketing. So in-store marketing has been used since the dawn of the junk food industry to do a really wonderful job selling really unhealthy food to people in grocery stores and other retail outlets for a very long time. The pricing strategies, promotional strategies, the placement, is it at eye height, how many boxes wide, how many boxes high, end caps, the little bins that you come in and watermelons overflowing. I mean, all of that is geared towards selling us food. But now we're trying to do something a little different. We're trying to turn this on its head a little bit and say, okay, let's figure out how to use these same, tried and true strategies to sell the healthy stuff. And we're also exploring incentive strategies connected to health. We're doing a project with the USDA right now looking at ways to use front of pack nutrition information, shelf tags, I'll show you some examples of those, to incentivize SNAP participants to make healthier food purchases. Here they are. This is just a sample of a couple of them. Some may be familiar to you. Bottom left, probably mostly. It appears probably on every cereal box, in this country. It's called Facts Up Front. And it's called Facts Up Front because it takes what's on the nutrition facts panel on the back of the package and it puts it on the front of the package. But there's other rating schemes too, and the purpose of those rating schemes is to use an algorithm. sometimes we know what that algorithm is, sometimes we don't, to determine the nutritional value of a product. And, extra points for nutrients to encourage. It's got vitamin C. Lose some points because it's got too much sodium. That's the idea. And then you translate that into a number, or you translate that into a logo. In the middle, on the bottom, is Walmart's. That's great for you. It's on 1,300, 1,400 in-house brands. Walmart, canned pasta, bread, cereals, canned vegetables, frozen fruits and vegetables, and so on. There's also tiered systems. I'm not going to go through all these in detail. I just want to sort of say that, one thing we all know is that we're sort of saturated with marketing messages and health messages on our packages. Upper left-hand side is a system that was originally created by Hannaford. It's called Guiding Stars. It's a 3-tier, 3-star system. 1, 2, or 3 stars. 1 is, foods that are good for you. 2 is, very good for you, and 3 are the best nutritional value, and God help you if you don't get a star. Here are our marketing materials that we use in our Healthy Corner stores. So we use the stoplight approach, and we translate this into numerous languages. And we put the logos on the front door and on the windows. We use clings on the refrigerators. We use shelf tags. So those are, on the edge of each shelf to guide people on how to make a healthier choice or which products to consider. WIC has been doing this for some time, by the way. Grab and go, making it convenient, right? There's a reason why Lunchables is cornering the market on kids' retail purchased lunches, and it's because you go like this, and that's it. That's all you do to create the lunch for your kid. And so retailers are realizing that for everyone, grab and go is an important part of their business. But it's also important for low-income residents because they're extraordinarily sensitive to price. And we have found in some of our corner stores and farmers markets pre-packaging so that this bag of whatever it is $1. And you can say, I'm going to get 3 of these, and it's going to be $3. And I don't have to think about I'm weighing this, and I don't know, and how much does this cost, and how much money do I have with me, and I don't have to worry about that. There's no scale. I have to go over there to find the scale, and there's a line at the scale. It can be tricky, right? Figuring out how much money I go to the grocery store, and I put some apples in a bag, and I'm not exactly sure. Do I have a pound? I'm not really sure how much I'm going to be paying for the apples. But a low-income, resident is going to be incredibly attuned to that. And so pre-packaging the produce has been something that we found to be really effective. And I'm not talking about fresh prep. I'm not talking about the cut fruit, of course, which is pre-packaged. But I'm talking about on the upper left-hand side, 1 bag of potatoes, 1 bag of peppers, 1 bag of apples. It all costs the same amount of money. Behavioral economics. Really, with a nod to Wansink and his group at Cornell, pioneered this work in school cafeterias. And it really gets down to making the healthy choice the easy choice, making the healthy choice the norm. We have refrigerators, freezers, sort of ice cream, frozen dessert freezers in schools, and the kids open them from one direction. And those eclairs, 320-calorie chocolate eclairs were always right there. And we moved them way over here. And then we put the 100% fruit popsicles over here. So now, if you want that, you've got to, stand there and you've got to hold the door open and you're a kid and that's hard to do. And so then you're reaching down to get the eclair. The sales dropped off so much they took them out of the case. So, no, kids didn't want them anymore. The frozen fruit popsicles were selling like hotcakes and they were happy. They were making money. The kids didn't really seem to notice, strangely, and it was a win-win. Homer Simpson. This is a wonderful, by the way. You Google behavioral economics and you click on images, and this was the first thing that came up, and I was delighted choice architecture. So Homer's saying, boy, it's too far to go for the donuts. I can't deal with this. I'm just going to get something nearby. And that, in a nutshell, is behavioral economics. It's, making the low-fat and skim milk eye height, making that be at least 50% of the shelf facings, putting the fruits and vegetables in an attractive display. When the kids go to the lunch line, they line up at the lunch line. And boy, I swear 8 times out of 10 that I go into a cafeteria and I look at the lunch line, they're lining up by the French fries and the cheeseburgers and so on. And I said, how about we have them line up by the salad bar? Let's do that. Let's have the first thing they get to while they're all standing there sort of waiting for something to do be healthy food. So the thing is, these are almost no-cost interventions, and we're seeing them more and more in a retail setting as a way to promote healthy food. This is a planogram. It says example only because my greatest paranoia is someone will think this is actually a great idea. This was my team, and honestly, my joke is, how many public health professionals does it take to come up and to agree on what should be in the planogram and what order it should go into? It took us a long time. This slide might have taken us the longest. But here, the idea is this is looking at a planogram, by the way, is something that food retailers use to guide stores on how to stock their products in refrigerators, on shelves, and so on. Stores are very familiar with doing this. They like it. They're given a full-color planogram, and they go and they stock it exactly the way it looks. So what if we changed the way it looked? And you have to, speak the retailer's language. You can't just say, I want the healthier things at the top. What does that mean? Well, tell them what it means. It means I want bottled water on the top shelf, and then I want skim milk, and I want a little bit of low-fat milk after that. And then I want some unsweetened beverages. And on the very bottom, you can put Diet Coke if or Diet Soda if you must. But this is exactly what I mean. And in the real world, of course, this would have brands as well. Healthy design. We can all turn around and appreciate a wonderful example of healthy design with the mobile market. But a lot of, sort of healthy streetscapes, closing down Broadway in New York City. I don't know whether anyone's had a chance to see that or been there. But an area that used to be congested with cars. The cars are now in the periphery of the city. And instead, it's this walkable little, tables and chairs, a place to eat, umbrellas, healthy food carts, these green carts, public markets, mobile markets, and buses. And this design that we call, we don't have a name for it, and we need a name, and I'm not a naming consultant, so I should ask some of the folks here probably for good name ideas. Healthy corner store in a box, pop-up corner store, modular corner store. Here's the before picture of one of our corner stores in Philadelphia. Typical, right? It looks like every convenience store in America. And here's after. It's like IKEA or something, right? You get this, I'm going to order this box. It's a pop-up corner store. It's designed for a small space. It comes with a planogram. It comes with in-store marketing materials. It comes with shelf tags. It comes with baskets. And honest to goodness, just researching the baskets alone, because we originally thought wood, it would be so nice and attractive, but the wood absorbs odor and then it gets mildewy. And so they're polypropylene because we didn't want the BPA. Each individual choice in this took a whole lot of research and effort to do. But in the end, it's this modular design. You can put it anywhere, into a dollar store, into a corner store, and this is, the exact same store as the before picture. Now, I would like to talk for a moment about understanding the reality, because it's very easy to be a public health professional in your somewhat, our ivory tower talking about, if they only did this, everything would be great. This is a wonderful design for a grocery cart that essentially, maps to my plate, right? Proportions of there's no dairy, but anyway, proportions of different food groups that you should be eating. And the idea was, if you just do this, and then you put this in grocery stores, do a cart that looks like this, put this in grocery stores, we'll solve the world's problems. Everyone will be eating healthfully. No one will be buying junk food. There's no place to put soda. And the problem is, it was a wonderful idea. I think it would be really great to get like a couple of these, maybe in kids' sizes, as part of an in-store tour, something like that. But a typical grocery cart costs $85 to $100. That doesn't include a cart like this. A large supermarket needs about 300 carts, and a very large chain would need many more than this. Even a smaller grocery store needs 100 or so carts. One regional retailer has 160 stores. That would be $3 million to buy new grocery carts. And who's paying for that? One large national retailer, the largest national retailer, has 4,000 stores. Oh, it would cost $184 million to buy new groceries. And who's paying for that? So when we come up with our wonderful ideas, and we all like to, and I am guilty as charged with, well, we'll just put a kiosk. Yeah, we'll do a kiosk in the produce section, and we'll scan something, and it'll have nutrition information on it, and we'll get a discount. It'll spit out a coupon. A lot of things have to go into understanding the scale of operations of a retail store. Every little change they make in a retail store costs money. They need to do training. You need to figure out how you're going to maintain it and update it. And it's just a little caveat to say, don't forget about the business model of a store. For example, where do you put the roll of toilet paper? Where do you put the pack of socks that you pick up because you're at BJ's or Costco and your son needs new socks? And where exactly are you putting the scented candle that you impulse purchased at the end of the end cap in Walmart or any big store, right? It's like they sell a whole lot by design other than food. So you have to, we have to root ourselves and ground ourselves into the realities of the business environment. Pharmacies. Pharmacies are selling food. And I'm sure many of you have realized that. They don't just sell candy anymore. They sell dairy. Some of them have frozen food sections. They sell bread, canned food, boxed food. And there's a really neat opportunity to kind of piggyback on this notion, this growing notion of the pharmacy being kind of the one-stop shop for, health resources, a local health resource. You can get a lot done at a pharmacy these days, a large, sort of national chain pharmacy, and probably to some extent some of the smaller ones as well. Numerous vaccinations. You can get it. Did you know you can get a strep test in a pharmacy? I mean, you can get a lot of health services, blood pressure screenings, and so on in a pharmacy. And maybe if the pharmacies could be included and thought of, because there's pharmacies in rural communities and there's pharmacies in low-income communities, and they may not be grocery stores, but they often function like grocery stores for residents. So we don't want to forget about them. One neat idea here is fruit and vegetable prescriptions. We've been working with a couple of local hospitals doing fruit and veggie prescriptions. It's really rooted in, basic social behavioral theory here. Your doctor tells you to do something that's important. And most people trust their doctors. And when your doctor says, you've just been diagnosed with type 2 diabetes, and here's what I want you to do, and I'm going to prescribe these medications, I'm going to talk to you about these lifestyle choices, but I also want you to eat fruits and vegetables. And here's where I'm going to give you a prescription, just like I'm giving you a prescription for metformin, I'm going to give you a prescription for fruits and veggies. And I'm going to tell you where to go to buy it. Here's where you can get healthy food. And maybe here's some coupons. Right? Here's some coupons for the healthier food. Wholesome Wave is doing this. They have a program called Veggie RX. And we are doing it with the hospital. It's tied to diagnostic indicators, so HbA1c level, and diagnosis driven, including type 2 diabetes and gestational diabetes. Health services in retail settings, I already talked about this, so I'll go through this pretty quickly, but this is, so thinking, of the pharmacy, but also in the grocery store, thinking about doing store tours, having in-store nutritionists, screenings, and so on. Mobile technologies, I have yet to have a conversation with a regional or certainly larger retailer, yet where we did not spend 15 minutes of our phone call or of our meeting talking about mobile technologies. It is absolutely the retailers all see this as a huge and growing part of their business. And the good news is that many low-income adults have smartphones, and that number is growing significantly. So Pew, tracks these things. I may be a little off on my numbers. I should have them here for you, but it was something like in 2010, 26% of low-income adults had a smartphone, and by 2011, it was like already 36%. So here we are, it's 2013. You can sort of extrapolate from there. Smartphones are cheaper, there's plans, they're more accessible. Do all low-income individuals have a smartphone? Of course not, but it's a large enough group that do, that there's something to capitalize on here. I would be willing to go out on a limb and say my guess is about half, give or take, of low-income adults probably have a smartphone by now. You can download coupons. You could play a nutrition game where, if depending on what your score is on the nutrition game, you could get a coupon. You could enable location services and figure out where to go to buy healthy food. Maybe it would be integrated with, where are the locations of the mobile market, where are the locations of the farmer's market, what are their hours. And of course, tracking loyalty cards and things like that. Youth engagement is not a new idea, but it's such a neat, wonderful part of what we do that I wanted to talk about it. And this is really energizing the kids to be a real change agent in their schools and in their communities. We have a program in all of the schools in the Philadelphia School District and surrounding communities called Snackin' Fresh and Hype, Healthy You, Positive Energy, where the kids are educated to make healthier food choices. The kids design, the materials and so on for their campaign. They do a big youth summit twice a year during the school year. They work with the rec centers and after-school programs. The kids go into community gardens and their own school gardens, and they harvest, work in the gardens, harvest the food, and then they sell it at their local corner stores. And they are so proud and so excited by what's happening, and really looking to them learn a tremendous amount from them, and looking to them to help figure out what they need and what works best for them. I alluded to briefly when we were talking about veggie prescriptions, this notion, which is fairly new, pushing the interventions earlier and earlier and earlier in the life course to prevent obesity in the first place, right? So we know more now about epigenetics. We understand that the environment of the baby in the mother's womb is incredibly important for sort of programming the child's genes toward obesity. And if we can do prenatal interventions, if we can do postpartum interventions to, help the mother achieve and maintain a healthy weight, help the mother eat healthy, fruits, vegetables, whole grains, low-fat dairy, and so on. And so that's integrated into farmers market tours, having a mother's group meeting at a farmer's market and giving them a tour in a low-income community. We partner with Wise Women, which is, I believe it was a CDC-led initiative to, in low-income communities, having women's groups come to the farmers markets, learn about nutrition, learn about healthcare. Postpartum, so of course, doing all of the above, but also promoting breastfeeding. How can we make this easier? Can we have breastfeeding support meetings at farmers markets? Can we, make supplies more available? Could we do coupons for pump rentals? I mean, all of this, instead of having it, and this gets right at the sort of systems approach that many of us are working in now, but instead of, okay, I need to go to this one particular place to get my supplies, what if they were more available in grocery stores, mobile markets, farmers markets?